Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 29, 2025. This video is on a New England Journal of Medicine article titled Increasing Potassium Levels in Patients' ICDs. It was published August 29, 2025. And it's also being presented at the meeting of the European Society of Cardiology in Madrid this weekend. Hypokalemia and low normal potassium levels, that's less than 4.3, equal to millimoles per liter, raise the risk of ventricular arrhythmias in ICD patients. To test whether raising potassium levels to high normal range, 4.5 to 5 millimoles per liter, lowers arrhythmia events, hospitalizations, and mortality. The study investigators of the podcast trial, it was a multi-center randomized open-label event-driven superiority trial conducted in Denmark. 1,200 ICD patients, mean age 62.7 years, 19.8% women, baseline potassium 4.01 millimoles per liter were the participants. Follow-up period 39.6 months. Stats, Cox proportional hazard ratio 95% confidence interval, event rate per 100 person years. The primary endpoint, what did they find? Primary endpoint of ventricular tachycardia, appropriate ICD therapy, heart failure arrhythmias, hospitalizations, and mortality was decreased from 29.2% to 22.7%. The hazard ratio is 0.76, p-value 0.01. ICD therapies, ventricular tachycardia reduced from 20.3% to 15.3%, hazard ratio 0.75. Hospitalizations for cardiac arrhythmia decreased from 10.7% to 6.7%, hazard ratio 0.63. The number needed to treat was 12.3 patients over 3.3 years to prevent one primary endpoint. Limitations, single country trial, unblinded. Less than half achieved target potassium levels. The effect may relate more to avoiding hypokalemia than achieving high normal range. Conclusion, modest potassium increase by about 0.3 millimoles per liter via mineralocorticoid receptor antagonists, potassium chloride, or diet safely lowered arrhythmic risk in ICD patients. Clinical pulse from the podcast trial, even low normal potassium levels may increase arrhythmia risk. Therefore, aim for a serum potassium level equal to or greater than 4.5 millimoles per liter in high-risk patients. Potassium elevation via diet, mineralocorticoid receptor antagonists like eplerenone, spironolactone, and or potassium chloride tablets is effective and safe. ICD interventions and hospitalizations for arrhythmia were notably reduced with potassium optimization. Targeted serum potassium modulation provides benefits beyond RAS inhibition, particularly relevant for ICD patients without heart failure. This is an affordable, scalable intervention with implications for global cardiology care, especially where device therapy is limited. Eponyms. Wilhelm His Jr. described the His bundle critical for ventricular conduction. Waldemar Mobitz identified Mobitz 1 and 2 AV blocks relevant to arrhythmogenic risk. Bernard Lown, pioneer of cardioversion and early defibrillator design, was a professor of medicine at Harvard Medical School and in the Brigham and Women's Hospital. There's a Lown cardiology group at the Brigham. Moss and Schwartz described long QT syndrome, a common ICD indication. The RALS trial 1999 showed that spironolactone reduced mortality in severe heart failure. Ephesus trial 2003 validated eplerenone post-MI in systolic heart failure. Emphasis trial heart failure 2011 expanded mineralocorticoid receptor agonists used in mild heart failure. Bertram Pitt is a renowned cardiologist at the University of Michigan and a clinical trialist, best known as the principal investigator of the landmark RALS, Ephesus, and Emphasis heart failure trial. His work transformed the management of heart failure by establishing mineralocorticoid receptor antagonists as life-saving therapies, highlighting both their mortality benefit and their role in arrhythmia prevention. I had the good fortune of being his colleague at the University of Michigan. Together, we co-edited a heart failure book along with Dr. Michael Giverts. Other important papers related to this topic are Ma et al. In New England Journal of Medicine, linked sodium-potassium excretion ratios to cardiovascular risk. Winslow et al. PLOS 2023, sub-study in total body potassium and podcast. McDonald and Struthers, Jack 2004, defined optimal potassium window in cardiovascular care. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.